my name's Alyssa. I'm a student PTA at Penn State Hazelton. Is it okay if I work with you today?
Of course.
Perfect. Can you verify your name and date of birth?
Apple Valley 9/29/2005.
And do you know where you are today?
At Seniors Home.
And what day of the week is it?
It is Thursday.
Perfect. So today I see from your chart that you have had a meniscal tear, and so you did have surgery to fix that.
Yes.
So right now we're just trying to get some strength back in that quad, since you did have to have that surgery, so your strength isn't going to be exactly what it was before. So for that we're going to be doing NMES,
Okay.
which is basically I'm going to be putting electrodes on your quad,
Okay.
and it will be stimulating those muscles to contract.
Okay.
For this, I will be finding a full contraction at first. I'm using a tetany mode, and then I will be going to unfuse tetany for the treatment, just because you won't be quite ready for that tetany mode for the whole treatment.
Okay.
So first, I'm just going to ask you some questions to make sure you are good to proceed with that. I see from your chart that active range of motion is not contraindicated, so we can continue. Do you have a demand cardiac pacemaker?
I do.
Okay. Do you have any superficial metal implants in that area?
I don't.
I checked your orientation. Are you pregnant? Okay. I'm going to check your skin to see that you don't have active bleeding. Do you have any cancer in that area?
I don't.
Okay. I'm going to check your sensation and to make sure you don't have any open wounds or edema. Do you have any heavy scarring or thick fat tissue in that area? Okay. Do you have chronic corticosteroid use?
No.
Okay. I'm not going to be doing this over your laryngeal, pharyngeal, or carotid sinus,
Okay.
or in an area that you find uncomfortable. Alright, so now I'm going to check skin in that area. I can see it is intact, so we are good to go from that standpoint. I do want to check your sensation.
Okay.
So I'm going to be doing light and deep test. This is light, this is deep.
Okay.
Okay. I'm going to do that on your left side. I want you to look away and close your eyes and tell me what you're feeling.
Deep. Light. Deep. Light. Light.
Very good. So we can continue with this. Now I'm just going to clean off the area. Actually before that, I want you to do just range of motion of that knee. So can you slide your heel towards your butt and then go back down? Very good. Now I'm going to clean the area with some alcohol. And when we do this, I don't want you to be feeling any pain.
Okay.
So if you do, tell me right away. I'm just going to put this underneath your knee here so that we can get a good quad set. And can you contract your quad for me? So like I said before, the first mode that we'll be putting it on is tetany, just to find that contraction and figure out what frequency I can go up to. Okay. So I'll be plugging these in, but you're not going to feel anything right away, okay? It's not on yet. I'm going to set this up so that I'll be turning up each side
Okay.
at different times. So I'm going to pick up your just going to turn the machine on so I can make sure the settings are right. So for this, we are on constant, because we're just going to be turning up the intensity to find the contraction.
Okay.
So we're on constant, the pulse rate is 30, and the pulse width is 200.
Got it.
Alright? So I'm going to be turning up this side first.
Okay.
So just let me know when you're feeling just a little bit of sensation prickling in that area.
Okay. I'm starting to feel it a little bit.
Feel it? Okay. So we're at 3 for that, and I'm just going to start turning up the other side.
Okay.
And let me know again when you start feeling anything.
Okay. Feeling
A little bit? Okay. Now I'm going to turn up your right side to find that contraction.
Okay.
Let me know when you feel it. Yep, okay. Now I'm going to turn up the other side. There we go. So we're at about 4 for each of those.
Okay.
So I'm going to turn that down now. How would that feel?
Not bad at all.
Okay, very good. So now we can move on to the treatment portion.
Okay.
We will be doing unfused tetany
Okay.
for this to get an isometric contraction and gain strength in that area. So I'm going to change the mode to synchronous so that both channels are going to be on at the same time.
Got it.
Okay. I'm going to have a ramp of 3 seconds, which means the on time will be a total of 16 seconds, while the off time is 80 seconds because it's going to be a 1 to 5
Okay.
ratio just because we're just getting started with this.
Okay.
Okay. Pulse width, I'm going to keep it 200, and then the pulse rate, I'm going to turn down to 15.
Okay.
Okay, and so then the total time of treatment is going to be 16 minutes.
Okay.
Alright. So I'm just going to wait till it cycles through one more time. Okay, channels are off. So I'm going to turn it up to that intensity that we found the contraction on before.
Okay.
And when it does turn on, it's not going to be immediate contraction just because there is that ramp time.
Okay.
And for the unfused tetany, it's going to be, it's going to look like a little bit of a shaky contraction because it's not going to be that constant.
Okay.
And you can just let me know when you feel it.
Okay.
Make sure you feel it when it comes on. It's a long off time. And I would be giving you a call bell
Okay.
if I were to leave.
Okay.
Your side.
Beginning to feel it.
Okay, yep, it is turning on. That looks good. How does it feel?
Not bad.
Okay. No pain?
Nope.
Okay, very good.
This feels a little funky.
Alright, that's back down where it goes. Okay. Very good. So we're going to say that we did that for the whole 16 minutes.
Okay.
So I'm going to turn the intensity down now on both sides. So I did forget to ask you earlier, what would you say your goals are from doing this treatment?
Just to kind of get my strength back.
Okay, very good. And is there anything at home that you're struggling with right now because of this weakness?
Just kind of walking around for more than short distances. Yeah.
Okay. And what was your your pain? 0 being no pain, 10 being the worst pain imaginable prior to treatment.
Maybe like a 4.
4? Okay. And what would you say? Do you think that pain has changed since we've done the
Maybe like a 3.
A 3 now? Okay. Good to know. Stick these back on here. It's really sticky. So is that Okay, I'm just gonna clean off the skin again. Okay. Now can you do that, let me take this from you, that range of motion that you showed me earlier, heel, very good, how does that feel?
Not too bad.
Good, okay. Now for your home exercise program,
Okay.
We're not going to be sending you home with your own EMS unit, so I want you to do some isometric contractions,
Okay.
just like this was basically doing for you. You can put a towel under your knee and do some quad sets into that towel, okay? And I want you to hold that for 6 seconds,
Okay.
and do 3 sets of 10 once a day, every day until I see you.
Okay. Sounds good.
And if there's any pain, I want you to stop, and then let me know next time I see you.
Sounds good.
Okay, any questions?
I don't believe so.
Okay, thanks for letting me work with you.
Of course.